the Bank of England back at September, and as we know, they've increased and have stayed high as well. So if we could move on, please. In terms of this slide, this is Public Works Loan Board. So again, this is over a much longer period of time, but since 1994. But you can see by that we're at the highest rate of borrowing costs since 2007. So again, kind of historical highs given the range of time this is over. Next slide, please. And economic growth at a comparator with G7, so at a high kind of macroeconomic level. You'll see there, as we probably all know by now, because it's been reported more in more detail, that UK is the only G7 country not to have recovered to pre-COVID levels of gross domestic product, and that's forecast to continue being the same. Which is obviously a significant impact, and as we'll see locally, that's having a profound impact on some households and families across the city. You'd move on, please, Gogo. So this reflects how that is being seen in Aberdeen City, how it's been experienced rather. The wage prices and wage shifting, the inflation against the actual income on the left, and what it means in real terms in money in your pocket. This was done towards the end of the year. In September, the most recent data available was the July data. We know that that's, I think, perhaps gone down again. So the real impact on inflation is at least a 5% decrease in real wage growth, and what that means for spending in the city. The next slide, please. And this is quite a busy slide. It's a local government dashboard, and this is accurate to October 22. But what it shows is a range of data. I won't go into all of it here. It's one we can share and we can go into. But for example, if we look simply at a council level, as a council landlord, we'll see on the left there that 14% of the previous quarter there, rent arrears, 14% gross rent arrears, that is across the estate that we have as a landlord. And we also know that at any one point in time, there will be around half of the 22,000 tenancies we have in rent arrears of some to some degree. Health and social care indicators are there as well, hospital delayed discharges, and this is all just building up a picture of the pressure and the range of pressures that are on households and therefore services in the city. And we look at absences there as well, and child and adult protection cases and business activity indicators, then we can see the overall impact there across the public sector as a whole. Move on, please, Gogo. So we now have child protection statistics that just, again, put another layer on in terms of registrations, work that's been taken forward, referrals being made, and the changes in them over time. Just to emphasise, for example, at the bottom right there, child protection plans by deprivation, and you can see the trends there and what that means, and the net changes over time as well. Again, just layering on. So if you could move on, please, Gogo. And here's just again more data, adult support and protection statistics. You can see adult wellbeing referrals over time in the bottom right increasing again against national average, and that's also adult at risk referrals as well, and adult support protection investigations over time. So just tracking that along with the cost of living crisis and the escalation of that gives us a different lens to look at. Move on again, please, Gogo. And then we've heard about domestic abuse incidents already today, and that simply shows here the correlation over domestic abuse incidents over the time, and the incidents per 1,000 head of population as a comparator. And we'll see there's been an increase, as we heard from Lucy earlier on today. And what we do know, for example, again, I'll speak from experience as a chief housing officer, is that there has been an increase post-COVID, due to probably relaxation of COVID restrictions, but also the cost of living, there's been an increase over that time in the presentations we've had for homeless people experiencing homelessness related to what we would class as domestic abuse markers against there. So we know that we're experiencing that through the doors every day and have been seeing that increase for some time. If you could move on, please, Gogo. And as you'll see there, that's just demonstrating that as I just spoke to, so we could move on again, Gogo, thanks. That's the rent arrears statistics mentioned earlier, a bit more detail there. So our rent arrears, spit it out, as percentage of rent due in the last available quarter, 14%. And that equates to about, I think at the moment, about £9 million in rent arrears. So significant challenges out there. We've seen it and heard at previous community planning boards, the work that the financial inclusion team are doing, for example, on benefits access, making sure that people understand what's available and working hard against this. But we can see the challenges that the current cost of living crisis is posing on us. We could move on again. Thanks, Gogo. See here the Universal Credit Job Seeker Allowance claimant statistics. Council average 3,500, Aberdeen City 2,000 claims ahead of that and increasing. So just again all layering on different aspects of what households are facing and the different range of claims. We know in the city that we had the highest number of PACE redundancy notices in Scotland, and this reflects some of those difficulties that the households are having again. If we could move on, please, Gogo. So some of the things we're seeing locally, and this might be some information you're aware of, but worth repeating. We know we're getting an increase in mental health presentations. We know that mental health presentations or issues increased during the pandemic, and I think what we're seeing is the city hasn't had a proper chance to recover from the pandemic before the cost of living has increased in those who were already vulnerable or became vulnerable through the pandemic. That risk has increased. In some cases, that position for those households and those individuals has worsened. We know there's been government help with UK government help with energy bills, but that's going to run out in a couple of months' time. And there's no sign that the energy market's going to return to pre-cost of living levels. Scottish Government rolling out Scottish Child Payment, an extra £5 every time. Scottish Government had introduced legislation that will end on the 31st of March around temporary freezing of rents in social and private rented sector. That has been that legislation will run out on the 31st of March, and it will due to an agreement being reached about rent increases being limited to £5 maximum in social rent, but there are still some restrictions on private rented sector as well, and obviously in the city, I think there are about just under 20,000 landlords registered. So this still has an effect on those who are renting premises, renting as a business opportunity. A moratorium on evictions remains in place for rent, though, and for rent arrears. And so we know there are multiple financial supports available from the council, from the Scottish Government, from UK Government, Department for Work and Pensions, but that is being increasingly sought, as we've seen in the previous slides, alongside that increasing number of redundancies that's been noted over probably the last couple of years now. And if we could move on again, Gogo. This is a busy slide. They will be shared, but it just demonstrates some of the difficulties at a more granular level. Without picking through all that detail, clear evidence that people a third of households have under £250 savings and couldn't cope with an unexpected bill. So if we think that our boiler was to break, our washing machine was to break, the fridge was to break, your car was to break down, that you needed to get to work, a third of families have no savings or under £250 to deal with some of those issues. Really finding families really stretched in terms of the overall household budget. Combine that with the cost of food increasing, and what I always come back to is the cost of staple parts and ingredients. So pasta, bread, milk, eggs, the things that families can buy, the things that we can provide to children to fill them up, fill ourselves up, become more expensive as well. So I won't go through this in any more detail, but we can see the pressures at a household level that people are facing. If you could move on, Gogo. And what that means pragmatically is that life expectancy, healthy life expectancy, are falling. We know that there are negative impacts in mental health in key household types, and these are ones we look at for poverty. And these are households that are identified through child poverty legislation and policy as being priorities. So where there's a child with a disability, single parent families, where there's a baby under 1 year old. We know that there's an impact. We mentioned mental health, but physical health as well. People not leaving the house as much, not being able to get back to maybe physical health as well as they were pre-pandemic, and this is compounding it. And that mental health aspect limiting some individuals' ability to work, thus creating demand on public services as well. And there are concerns here around certainly those family groups, for example. When you can't afford to heat your house, it's pretty obvious, but that's a cold house. A cold house becomes a damp house quite quickly. And as we've seen, sadly, down in England and elsewhere, the impact of cold, unventilated houses becoming damp, growing mold, impacting on physical health, respiratory disease, for example. It's just one element where we need to be more vigilant. So that's probably a quicker run through of the slides. We can return to the paper that's on the agenda. I don't want to go through that in any further detail, but I thought one thing I was asked to look at is where there are services already working in areas and where there are perhaps some gaps that we might want to address. And I'll come back to that. I think there are, you'll recognise yourselves hopefully through the range of data there and the range of issues raised that there are a lot of single agencies working on these, council, police, fire, NHS, obviously health and social care will face some of these issues on a daily basis, and working well on a single service level. We come into partnership level, both at community planning level through the outcome improvement groups we have, but unofficial partnerships where officers are just working ahead, that they understand who they need to work with to make things better for people, are working well. But probably a plea rather than pick out individual areas. It's a plea, and it has been discussed before here at the board, for all the chairs of outcome improvement groups to speak to the members of the groups and identify where they think there's progress to be made. Certainly in the groups that I chair, anti-poverty and community justice groups, there are gaps there, and there are project end reports being heard. There's space to do new projects. We're actively looking at them. And for example, I chaired the anti-poverty group this morning. One that came up was a suggested increase in complaints or police incidents being recorded for mothers and fathers who are stealing or being caught stealing formula milk for their children. Weight loss associated in younger people, corresponding with the timelines of the cost of living, how we work along with each other to look at where there are protected characteristics, groups and individuals. We might not focus on those areas and those groups as much as we could rather. I'd suggest that's a gap that's worth focusing on. And one that came up last week for us, I think, to think about is how we work collectively as a partnership with the international students that are coming into the city to make sure that we are supporting them as best we can. Councillor Nicoll and I, along with Councillor Ewell, met with RGU colleagues last week, and that was a source of discussion, how we do that most effectively. There's a significant influx of African students with families to the city. We're tracking that elsewhere through refugee and asylum work as well, that increase in population there. So I think there's probably a good scope to do some work there. I'll pause there, Chair. Wonder if there's any questions or any comments on that. Thank you.
Thank you very much for that, Derek. Has anyone any questions? Councillor Radley and then Councillor MacDonald, please.
Less of a question, more of a comment. Would it be possible to get slides circulated? They've got lots of very useful detail in it. It would be good to have a look at them more closely. Thank you.
I think Derek said he would do that, so hopefully that'll happen. Councillor MacDonald?
Thanks very much, and I think thank you very much for the report, Mr. McGowan. I think the focus should rightly have been on families and pensioners, particularly over the Christmas period. We have been, just speaking day to day, in a fairly good period of fine weather, which will have helped a little bit. But I do think, and there was a report from Citizens Advice saying that one of the groups that is perhaps missing out, as you might have been alluding to, was council tenants and also single people but are working. So we need to make sure that we do pick up on those groups who may now be presenting as vulnerable, who might not have been before, and make sure that we're not leaving anyone behind. But but the focus a lot of the focus has been on families quite rightly up till now. That's really a comment more than a question.
Thank you very much for that, and I can but agree. Any further questions? I'm not seeing anyone. I think the last meeting we left on quite a good report. This is quite a downbeat report, and definitely very worrying. But I would say that Mr. McGowan at the end did mention that we had a meeting at RGU. And the one thing that came out from that was the really good work that was being done collaboratively between health and social care partnerships, councils and the university education bodies to actually deal with some of the situations that had come up with the influx of students to the city, many of whom are being accompanied by family members or young children. So there is maybe a wee bit of good news there that Mr. McGowan didn't quite get to as strongly as he might have. If there are no further questions, we can perhaps agree the recommendations, but before doing so, I'd like to thank Mr. McGowan. He's off from the city. He's heading to Edinburgh to take up a new post there. You will be sadly missed, Derek, I'm sure not least by the community partnership, and we would wish you every success in your new post. Thank you very much indeed. Thanks.
Thank you for the kind words, Chair. It's been a pleasure. If I could just say, when I first came to Aberdeen, one of the things that was really attractive about it was that community planning in Aberdeen was well established, well ahead of the game. The LOIP was already published really quickly. It's been a pleasure to be part of it. So thank you, and thanks to everyone I've worked with over the last 6 years. Appreciate it.
Well, thank you very much. Can we agree the recommendations on page 190? Agreed. And I'll then close the meeting and we'll meet again on the 19th of April. But thank you very much again. Thanks.